Welcome to United Health Services at Wilson Regional Medical Center. I'm Gloria, one of the many people who will be helping you on the road to better cardiac health. In the course of your stay here, you will see many people, physicians, specialists, respiratory therapists, technologists, nurses, unit assistants, and many support staff, all with unique responsibilities, but all with one common goal: your good health. This group of talented individuals work together as a team to provide you with very good care. You are about to undergo a unique life-enhancing procedure, but probably have many questions and are unsure of what to expect. That's why we've made this video, to give you a brief, step-by-step guide of what you and your family can expect before, during, and after your surgery. We hope this will help you understand some of the different sights and sounds you will encounter so that they may not seem so strange. We will introduce you to some of the technical jargon we use on a daily basis. We feel it is important for your recovery and that you gain a better understanding of what you can expect both physically and emotionally before and after your surgery. In addition to this video, you will receive informational booklets explaining your surgery and its benefits. To start with, let me tell you about the cardiac program at United Health Services. Since 1989, our experienced team has performed over 35,000 diagnostic cardiac catheterizations, more than 5,000 open heart surgeries, and 7,500 angioplasties. Known as the Robert M. Best Center for Cardiac Services, we are recognized as a highly qualified cardiac center, promoting cardiovascular health in the southern tier of New York and northeastern Pennsylvania. Drawing on this extensive experience and our technical know-how, we will work together as a team to provide you with compassionate, high-quality care. Your cardiologist has determined that you are a candidate for heart surgery. The following video illustrates the typical sequence of events you could expect before, during, and after your heart operation. One of the first steps will be to meet with one of our cardiovascular thoracic surgeons.
Good morning. Hi, I'm Dr. Yusuf. I'm one of the heart surgeons here, and your cardiologist asked us to see you because of your heart problem. I just want to ask you a few things before
The surgeon will talk with you and your family about the operation and outline your plan of care.
But I think the overall advantage to you calculates out in your favor to do this. The other point is that your coronary bypass procedure is going to be done without the use of the heart-lung machine. It's going to be done using the beating heart technique, and the Mays procedure that
you can use this time to ask the surgeon about the procedure.
So do you have any other questions about the procedure or the timing?
Well, no, I guess it's sounds like we got to do something, and I guess we might as well get on with it.
So if we can get it done within the next 24, 48 hours, would you be agreeable to that?
Yes.
Your family should feel free to ask any questions as well.
Well, I just wondered how long will he be confined, and will he be able to be up and around, and how long before he's back on his feet?
Generally speaking, a patient will remain hospitalized on average, I would say.
Hi, Mr. Newman.
Yes.
Hi, I'm Karen. I'm from the lab. I had to do some blood work on you today.
Okay. I heard you were coming.
Have you had this done before?
Yes, I have.
Your surgeon will order lab work, an x-ray, and other special tests that are needed to get you ready for your surgery.
Check your name band.
There will be many people involved in your care, each providing unique and necessary services.
Okay, what we're going to do here first off is a quick breathing test. This is pulmonary function screening. It's very important so that the anesthesiologist knows what your lung function is before he puts you to sleep. Now, what we're going to do, first off, you're going to put this on your nose. Then I'm going to give you this. When I tell you to, you're going to take a deep breath in, put it in your mouth, and blast. Blow it out as fast, as hard as you can blow it, for as long as you can.
After performing some tests, the respiratory therapist will discuss the need for deep breathing and coughing after surgery and demonstrate the use of an incentive spirometer.
Very good effort. so that it's probably the most important thing that you do for yourself to keep pneumonia from building up here. It prevents what's called atelectasis, which is subsegmental.
Deep breathing and coughing exercises are very important to your recovery, and you will be shown how to do these exercises.
And you can get pneumonia that way. We don't want that to happen. Okay? And I'll coach you to get you started. Put it to your mouth. Now blow out. Blow out. Blow it out, 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 blow it out. Suck. Smooth. Hold your breath. Hold it. Hold it. Hold it.
This will be a busy time for you and your family. You will be given an opportunity to take a tour of our coronary care unit, or CCU as we call it. One of our nurses will ask you if you have thought about or prepared an advance directive or healthcare proxy, and if not, our nursing staff will provide you with information about this matter. You will also have the chance to talk to a volunteer from the Mended Hearts program. The Mended Hearts volunteers will offer you support and reassurance and answer some of your questions. All of the Mended Hearts volunteers have had heart surgery, so they will be able to understand your concerns. Before your surgery, you will also meet with an anesthesiologist.
Good morning, Mr. Newman. How are you?
Well, good morning.
I'm Dr. Patterson. I'm one of the anesthesiologists here. I'm going to be helping you out tomorrow with your surgery. You're having a bypass procedure tomorrow. Is that correct?
Yes.
I read your chart.
The anesthesiologist will ask you a number of very important questions, such as, have you ever had surgery before? Did you have any trouble with the anesthesia? And have you taken any medications today?
For your surgery to come on downstairs. The nurses are going to give you some medicine before you come downstairs. They're going to give you a little shot in your arm that'll make you kind of sleepy, okay? Like the medicine you had when you had your cardiac catheterization, it's the same medicine.
Okay.
So it'll make
In order to start general anesthesia, an IV line will be put in your arm and you will be given medications to relax you.
Then we give you enough medicine through your IV that you go off to sleep for your surgery. And you're so far asleep that the anesthesiologist has to put a little tube in there to help you breathe. You won't know it went in because you're sleeping when it goes in, okay? But you'll also wake up upstairs in the coronary care unit later with that tube in place. They'll keep you real sleepy so you can tolerate it. But just so you know, don't get scared that that tube's still in there. It's the way we do it all the time, all right? Another special IV we start after that goes on the side of your neck. You won't know it. Everybody gets it, and it lets us watch some special pressures for your surgery, okay? So when Mrs. Newman comes to see you, don't be scared that there's a lot of IVs hanging there. We intend to put them in there before the procedure even starts, okay? You have your surgery.
After midnight, the night before your surgery, you will not be able to eat or drink anything, except maybe a small sip of water to take medications. You are now considered NPO, which means nothing by mouth. On the morning of your surgery, you may be awakened as early as 5 a.m. to prepare you for surgery.
I'm going to help get you ready for your surgery today.
Time already?
Yep. Now make sure you don't eat or drink anything before surgery, okay? And Lizette's going to come in, one of our aides. She's going to help get you prepared for the surgery. What she's going to do is she's going to...
Your prep will include having your hair clipped from your shoulders to your ankles. You will also be required to take a shower or bedside bath with a medicated cleanser.
So what I'm going to do is I'm going to start with the top first. We'll do the top half and then we'll do the bottom half. And I'm going to raise the bed a little bit.
After this preparation, the operating room staff will come to take you to the operating room. They will check your ID bracelet and ask you some questions. They may also start you on oxygen.
Correct?
Yes, yes.
They give you a little shot or pill this morning?
Yes, they did. Yeah.
Okay. You feeling a little sleepy or
Yeah, it's kind of druggy, you know.
a little dry in the mouth?
Yeah.
Good morning,
Okay.
Mr. Newman. My name is Marilyn. I'm one of the registered nurses from the operating room. Is going to take very good care of you today.
Okay.
How you doing?
Pretty good, I guess.
I'm going to ask you probably some of the same questions that Dave just asked you. And did you have anything to eat or drink after midnight?
No, I'm getting hungry too.
You comfortable? We keep you covered up because the hall gets a little chilly sometimes. Oxygen is on. Okay. Ready to roll?
Let's do it.
Okay.
Hi, Mrs. Newman. My name is Marilyn. I'm one of the nurses from the operating room. It's going to be taking very good care of him this morning.
We're going into the Decker Center now, and this is where coronary care is. This is where he'll be coming after surgery. When he gets here, he'll have his own nurse to take care of him and only him. It's going to take them about 45 minutes maybe to settle him in. During that time, that's when Dr. Yusuf will come out to this waiting area here and tell you how everything went. And when you go in to see him, remember, he'll have a breathing tube, breathing machine, IVs, all that is normal, so don't be scared when you see that. And you did tell me your children are going to be here. That's good. They'll meet you here.
Yes.
You don't have to stay right here because we don't make periodic phone calls with progress reports. You can go across the street and get breakfast or coffee, whatever you'd like. And your children will be coming here, I heard, and they're going to wait here with you. You can wait either in this room here. Sometimes it gets a little crowded. Over here is another waiting area. The restrooms are over here. This is the desk where the people from Mended Hearts are. They're very helpful. If you have any questions, that's where you should go because they've been through it either as a patient or a family member, and they will be able to help you a lot. We really depend on them a lot. They're very good group.
That's good.
This is where we part ways. We're going to go down that way. That is going to the second floor. We're going to the operating room. CCU is all behind these walls over here. And that's where we're coming when we're done. So we'll let you give them a little kiss and wish them well, and then we'll whisk them away.
Goodbye, Ray. Okay, good luck on it.
Yes.
All righty. You ready?
Bye-bye.
Bye-bye.
We're going to take very good care of them, and they'll take very good care of you up here.
Oh, I'm sure.
Okay.
You will be awake when you enter the OR. You will be aware of the activity from the operating room staff. You will hear the sounds of the operating room machines, and you will also notice that the operating room seems a bit cold. The OR has to be kept cooler temperature for all the equipment to work properly. All of this is normal. You will be given some medication to help you relax. You will still be alert at this point, and you will be able to ask questions or voice any concerns you may have. When the surgery is finished, you will be taken directly to CCU, where your recovery will begin. You will spend about 48 hours in the CCU. You won't remember much of the first day after surgery due to the effects of the anesthesia. You will still be hooked up to the ventilator, which assists your breathing. When you wake up, you will hear many strange noises: the ventilator, the beeping of the monitoring equipment, and the normal bustle of the doctors and nurses taking care of you and others in the CCU. This is all quite normal.
Okay, Mr. Newman, I'm going to put you on the ventilator. Just relax. Yeah, that's actually. Okay, just let the machine breathe for you.
Ray, are you awake? There you are. Hey, your surgery's done. You did very well. Okay, you got a tube in your throat. Just relax. Can you squeeze my hands? Good. And wiggle your feet. That's it. You're back in the CCU. You can just relax and go back to sleep.
You may feel some discomfort from the breathing tube and possibly a little irritated at not being able to talk, but that will subside. The tube may be removed in a few hours after you wake up. You'll be able to have visitors, but you may be a little groggy from all the medication.
Relax your mouth. Jaw open.
Ray, your wife is here.
You did good, hon. It's all over.
Once he's fully awake, we'll take him off the ventilator, and then he'll be able to talk to you. We'll have a nurse in here with him all the time until he's fully awake and stable. So we'll take very good care of him.
I'm sure you will.
The first morning after your surgery, you'll be getting out of bed, sitting in a chair, and eating small meals. You'll be able to talk to nurses and your family. You should talk openly about how you feel and tell the nurse of any pain you may be feeling so you may be given the appropriate medication. On the day following your surgery, your physician will direct you to participate in the inpatient cardiac rehabilitation program. During this rehabilitation period, we will help you to move to a chair 3 times a day. We will also instruct you in a range of motion exercises for your arms and legs. This activity will help decrease the usual deconditioning problems associated with bed rest and help you to gain confidence. In about 2 days, you will be transferred to an intermediate care unit, where you will stay until you are ready to leave for home. In this new room, you'll be able to receive more visits from family and friends and watch television. This is your recovery time, and you will be responsible for helping with your recovery therapy. At this time, you will also be given dietary counseling.
Hi Ray, my name is Mary. I'm a nurse here on the floor, and I brought you one of our heart pillows that we give to surgery patients. What you can do with this is splint your chest, hold it up tight against your chest and do deep breathing, and then do some coughing afterwards. I'm going to have you try that.
Something like this
Hug
here?
it right tight. Hug it real tight, and then you want to do 3 deep breaths and do a good cough afterwards.
It hurts to do that.
Yeah, and that's what this is for, to help ease that discomfort.
It'll get better, I hope.
Yeah, it's kind of hard the first time. Good
I
job.
think it does help to hold the pillow on it.
And that'll keep your lungs moving to keep them healthy there. Okay? I'm going to try to do that every hour. Do it along with your breathing little instrument there, the incentive spirometer.
Okay.
Do this along with the deep breathing, okay? That should help. All right, call me if you need any help with that, okay?
Thanks.
And bye-bye.
In the following days, we will provide you with an individualized exercise program of proper intensity and duration to improve your cardiac fitness. Much of the exercise involves walking in the hallways. Inpatient cardiac rehabilitation will assist in the process of teaching you and your family about cardiac disease, how to modify the risk factors, home exercise guidelines, how quickly to increase activity, and to assist in a safe return home and doing normal everyday activities. In addition to your physical recovery, your emotional recovery plays an important part of your total health. Emotional support for both you and your family is critical, and your care providers and Mended Hearts volunteers can be of assistance. It is usual to have some emotional ups and downs. There will be days when you are relieved that the surgery is over and successful. There will be days when you'll cry and wonder if it's worth going through all of this. These emotions are common for anyone who has gone through major surgery. Don't be surprised or upset if you experience a period of low energy. As you push yourself to get better, you may experience some fatigue. This is your body's way of telling you to slow down a little and rest. Eventually, things will level out and you will feel more like yourself. Upon your discharge, you will be given detailed instructions regarding your medication, diet, activity, and lifestyle changes. When you see your physician for your follow-up visit, you should feel free to ask any questions about your recovery. Most heart surgery patients are referred by their cardiologist to join an outpatient cardiac rehabilitation program, such as the one located at Binghamton General Hospital. You will attend exercise sessions in a medically equipped gym staffed with registered nurses and a clinical exercise physiologist. Individual and group instruction covering how to modify heart disease risk factors, heart-smart eating, coping with cardiac disease, and exercise guidelines will be offered. We hope that this video has helped to answer some questions or concerns you or your family may have about your surgery. If you do have any additional questions, please ask your nurse or your physician. On behalf of all the cardiac team members at Wilson Regional Medical Center, I'd like to thank you for watching this video, and I'd like to assure you that our team of professionals will strive to provide you with very good care.